Today we are going to see the next interesting topic in Unit 5, that is lithotripsy. So, the learning objective of today's section is that first we will be discussing what is meant by lithotripsy and a working principle and mechanism of lithotripsy, and we also have a deep discussion on what are the different procedure or step-by-step process which is being involved or carried out during a lithotripsy process. And also finally we will have a broad discussion on what are the different modern innovation it's happening related to this topic. So before getting into this main core topic, let's start looking from this point of view, that is a person perspective, patient perspective. So if you see the patient with a clinical condition called kidney stone, they usually have feel like anxiety and fear, and they will be go through very severe pain, and also they literally lose their confidence and finding so many challenges to carry out their daily physical activities. And also emotionally, if you see these sort of patient or the people feel very fear or very hesitate to carry out the surgery, because they are very care about or concerned about what is the recovery time. So because if you heard the word surgery, immediately all the patient will get panic, because the surgery which involves opening of your body, right? So these are the things which put the patient under the stress and hesitate to do carry out their treatment process. This is the major challenges you are facing by the patient right now because of this kidney stone. So not only this, the patient may also feel so many physical, may have so many physical impact, and as I told you before, they feel very tired, they have a very severe chronic pain, nausea, and so many things. And also it was slightly from physical to emotional. They will have a burden of like doing surgery for or taking tablets, or there are so many worrying about recovery and so on, because they it's the surgery, after surgery they don't know what is the outcome. So the uncertainty may happen, so they feel very concerned about that. So and also because of this surgery and so many things, at the later stage they will have a very disturbed lifestyle, because before surgery they will be following one type of lifestyles, but they it will not have go through the same way after surgery also. So these are things that different aspects is being collected from the patient experience. So on the whole, if you put in one thing, the outcome is that they are finding the challenges. So they are first putting the putting the things to be very clear about doing surgery non-invasively, that will meets the both physical needs and the human concerns. So this is the major challenges. So as the whole, as I said before, first we have to identify what is the problem. As we already identified, the problem is that the kidney stones, because it will leads to obstruction, and if it is not treated at an early stage, ultimately it will end up with kidney damage. So problem easily identified, that is the kidney stones. Anyway, we have to treat this kidney stones. But what are the options it's available, in the sense it is an invasive options. So what the patient is expecting is that it's a non-invasive solution. That is a second, the problem identified, the kidney stones is paining huge problem, so that we have to remove. The treatment requirement is that they need non-invasive solution. So as solution that we have abroad here is nothing but lithotripsy. So lithotripsy is one sort of technique. Here we are using high focused energy to fragment the stones, to break the stones. So this is one sort of non-invasive solution, that is what the patients is expecting. Okay, so in this way the lithotripsy doing their work what exactly the patient is needed. So, what is actually the science behind the lithotripsy? So, as I said before, the very simple working principle is there in this lithotripsy. Just they are going to pass very high energy, that is a focused high energy right away to the targeted kidney stone, so that these high energy has the potential to break the stones into small pieces. At the later on stage, these small pieces will easily get it out from the body through natural passage. Okay, example like through urines or through some other things within 1 day or 2 days. All the fragmented pieces, the smaller pieces will get rid from the body. So this how the lithotripsy is working on. The here thing is that what type of energies we are using, how we are navigating that energy to the targeted area. These are the things we have to consider when we are designing such lithotripsy, because we have to send focused beam to make it align and hit on the kidney stone. Then only the kidney stone will get break. So for aligning and focusing, we are using so many things. Here we are here for this technique they are using water coupling method. And also for passing the energy, they have different types, like in some case they are using shockwave. For In that they may be using electromagnetic, I mean electrohydraulic, electromagnetic on piezoelectric to generate this sort of energy. And after once the focused energy is being generated, then these focused energy we have to make it to be aligned with the, I mean make it to be hit on the kidney stones. For focusing and condensing manner, we are using what, water coupling or water cushion coupling method. So once focused, automatically it will the thing is will goes into the right path, and the kidney stone will start to get break. And also one more guidance system is there, that is the imaging guidance system. So here we are using the x-rays or ultrasound to visualize whether all the shock waves, all the source of energy whatever we are applying, whether it's reaching to the targeted area or not. So in real time we can usually visualize the whether treatment is aligned or going in right pathway or not. So in this way, this lithotripsy offering very good solution. It's a non-invasive solution. We are treating from the outside body and breaking the stones inside the body. So this is the beauty of this extracorporeal shockwave lithotripsy. This is the old standard method, and it giving non-invasive stone treatment. And it really provides a patient with less disruptive therapeutic options. So, what is the advanced lithotripsy technology is that apart from this ESW, that is extracorporeal shortwave lithotripsy, we have the laser lithotripsy and intracorporeal methods. So, in laser lithotripsy, instead of passing shortwave, here we are passing the laser. The only the source of the energy is getting changed. Remaining all the setups like focusing system, guidance system, everything same. So, for here laser, they are using helium arc laser. And the once the laser is being passed, it may, when it hit on the kidney stone will break into so many pieces, and then later it will pass it out from the body through urine or stools. Intracorporeal methods is just opposite the extracorporeal methods. Here they will make a small incision on the body, and they will send the endoscopes. Through the endoscope they will passing the energy. So where this particular intracorporeal method is very much needed in the sense, or recommended in the sense, when the stone is very big, very large, it is very hard to deal with the laser or extracorporeal methods. That is a non-invasive type. So in such a case only they will go with intracorporeal methods, because intracorporeal methods is something, it's an invasive type, because we are making incision, we are sending the endoscope inside. Through the endoscope only we are passing the energy source to break the kidney stones. So these are the some of or few advanced lithoscopy technologies. Next we will see what is the actual procedure which is being carried out during ESW process. So ESW in the sense extracorporeal short wave lithotripsy. First is positioning is very important before starting the treatment. So the patient should make it very comfortable, and then maybe will make them to lie on lithotripsy table. with the water coupling, because the water coupling is the focusing system. Then second one is stone localization. Then we have to identify where the stone is there, whether right or left or in exact location. We have to predict before we sending the source of any sort of energy. So what, how we can locate this means, we by help of visualizing system. We have ultrasound imaging, or if you can even you can use X-ray systems also. And then energy delivery. Once the targeted area is been fixed, then we will go with the energy delivery. Then through this, we will sending water. Your focused energy, we will through the water coupling method, we will make it to hit on the kidney stones. Once it pass it and interacted with the kidney stones, everything will get fragmented, like it will be shattered into so many small pieces, which is very much easy for natural passage through the urine. And after that, natural elimination is happening. All the fragmented pieces will easily get out from the body through urinary system within 1 or 2 days. Even it, in some cases, even it will take weeks also. So through which, through the whole process, we can easily break the kidney stones to with the no kidney stones. So like a kidney, stone free kidney. So this is the procedure of ESWL. So this is the schematic diagram. It clearly represent what is happening during a procedure of ESW. As I said before, you have both top both side, like one in below. We will send X-ray tube. Then through this X-ray tube, X-ray will be sending. This X-ray is mainly used for visualization. So once the X-ray is interacted with the kidney part, the reflected rays will being collected with image intensifier. It will visualize what is the kidney, and where is the kidney, and where the stone lies inside the kidney. This is a image guidance systems, and the other side parallelly we will be fixing the generator, that is a shockwave source generator. Through this generator we are pausing the shockwaves once the kidney stone is being localized with the help of X-ray system. This is the actual representation of lithotripsy unit. So parallelly we can usually visualize whether treatment is going properly or not, and the kidney stone is slowly it's getting deteriorate, or fragmenting formation is happening or not. So, what is the outcome of this lithotripsy, and what is the benefits of patient in the sense? This lithotripsy is accounting for 85 percentage of success rate. It means that it clear the stones very effectively for uh, most people with kidney stones. And also day recovery, it's not extending more than weeks. Within 1 or 2 days, the people is getting recovered and they started to do their daily activities. And it is full and full outpatient procedure, that is 95 percentage is outpatient cases only. So this overall benefits and the impact is creating very good potential or solution for the patient with applicable for patient with kidney stones. So the, as I said, this is the something new tech, new thing which totally aligned with the human centered technologies, because this is the technology is giving solution by concerning the human problems. So like it giving minimal in a non-invasive method treating the problem before getting into worsen. That is the, yeah, preventing from kidney damage. Yes. Then this one is like one student activity video. This we usually have conducted during class hours. Here we will form a team of two people, uh, and they we will ask each team to have a discussion on different types of lithotripsy and their advantage and limitation, and followed by the each team will also come up with the new industry innovations related to this topic, that is lithotripsy. This is a small activity we used to play in the class, and this is the assessment related to this topic. Later you can read it out. Next one is the mind map. That here it gives a picture of overall summary of whatever we have discussed so far. That is the lithotripsy, how it is working, what is right from the patient perspective, what is the kidney stone, what is the problem will be faced when the patient is having kidney stones, and how lithotripsy have come into the, I mean, lithotripsy has come into the picture. What is mean by lithotripsy and the working principle of lithotripsy, and what are the different components of the lithotripsy. And also we have a discussion of different types, right? Laser type, about extracorporeal, intracorporeal types. And also we discussed different procedures, like we will have for different types of lithotripsy, we have different procedures. And then we discussed what is the clinical impact and patient benefits of one using this sort of lithotripsy. So, if you want to further understanding or get to know deep knowledge about this topic, you can refer this list of books and website. Here I have posted for your kind reference. Thank you.